Hey, yo, hey. I hope everyone is doing amazing. So I'm going to want to read this article. It's titled The Effects of Multiple Sclerosis on Your Body. And this is from healthline.com. And because I speak on sometimes about whole health, and a lot of the symptoms with MS can include a lot of parts of your body. So we're going to go ahead and skip to the meat of the article, which is primary versus secondary MS symptoms. This says MS directly affects the nervous system as the body's immune cells attack myelin in the brain and spinal cord. The symptoms can impact other body systems and cause nervous system symptoms such as pain and weakness. The primary symptoms of MS are those that occur due to damage to the myelin sheath and the nerves within. Doctors may treat these symptoms with medications to prevent MS attacks and slow demyelination, and this can include vision loss, weakness, sensory changes, and trouble concentrating. If you follow me, you can see a little bit of the trouble concentrating in my videos. I don't cut a lot out, that's too much. And I really want people to get a sense of little things, that can impact the daily life, overall health, quality of life. So I'm also reading these articles to practice my reading and my speaking. It tends to help with aphasia, pronouncing and taking my time. So it's like a 2-in-1 that I'm doing right now. So let's go ahead and move on to secondary symptoms. Okay, so the secondary symptoms of MS are complications that arise to the direct effects of MS. The examples can include urinary tract infections that result from weak bladder muscles and a loss of muscle tone that results from an inability to walk. Doctors may treat secondary symptoms with medication and other therapies. In some cases, slowing the progression of MS can prevent secondary symptoms. So I'm not talking about the article, well, I am speaking on the article, but I would like to notate preventative care. Everything you do for the health of your body should be to prevent anything from happening. So if you start out relatively healthy, you can prevent a lot of stuff from, like you can prevent diabetes type 2. You can prevent that if you, not acknowledge, but if you're aware of certain factors, or you school yourself. Okay, there are many ways that you can prevent things, but what I wanted to get to is that you can prevent some of the secondary symptoms or lessen some of the secondary symptoms without medication. Prevention without medication is the goal. So medication, like, we don't want to even, if we cannot be on pharmaceuticals, that's the goal. Because once you're introduced to pharmaceuticals, there can be some side effects from those pharmaceuticals that then you have to deal with. Okay, so if a disorder, one of the side effects is nausea, right? So then you take some medication for the nausea, but then the medication for the nausea causes you to have headaches. You get what I'm saying? So whenever you introduce a new medication, make sure you go over that with your doctor and you do the research yourself. You don't want any adverse interactions with your medication. For me, I make sure that I don't have any medication that has side effects of depression or suicide, because those are things that I deal with. So if I can prevent being on, okay, so then I gotta, work on my cholesterol through what I eat and how I move my body. So that's an example. I'm not saying that the cholesterol medicine, gives me those side effects, but it's just a out example, just thrown out there. Okay. So the nervous system is a big deal. And I do have a book around here, how to heal the nervous system or something like that. It might be upstairs, but coming from the article on healthline.com, I'm going to read now. As the immune system damages the myelin sheath, nerves are exposed. So that's like if you take a cable cord, right? A cord. And then you take this plastic off, and then all the wires are exposed. Now that's danger. This is protection. The black part is protection on here. So you've lost part of your protection. In this case, talking about MS and the myelin sheath. If the nerves become damaged, scar tissue known as plaques may form in the central nervous system. The result is that the nerves within the brain do not communicate efficiently with each other. This can cause nervous system symptoms that include, so yet again, we have symptoms from a problem. So yes, we're going to treat the problem, but we also have to look out and be aware of the symptoms. And if you don't have symptoms, do things to go ahead and prevent yourself from, if you can, because these symptoms are a little wild. So hold on. Some of these symptoms include dizziness, vertigo, confusion, memory problems, mood or personality changes. People may also experience depression as a result of MS or from the difficulty of coping with the disease. Though less common in advanced cases, MS can cause tremors, seizures, cognitive problems, that's me, that closely resemble other neurodegenerative conditions such as dementia. The impaired nerve signaling between the brain and the organs, muscles, tissues, and cells served by the damaged nerves affects many body symptoms. Okay, vision and hearing loss. For many people, vision problems are the first sign of MS and can begin suddenly, affecting one or both eyes. Story time! So, I lost vision in both of my eyes. I can see the scene. Like, this was in my old townhome, where I was living with my kids. And when you walk in, the couch is right here next to the door, and it's open. And then you walk a little bit further back. The stairs are by the door, and further back is the kitchen. And but you can't see the kitchen. You see the little dining area, right? So I mapped out this house already using the walker, and I've had to crawl around. So I already knew my area. I was sitting on the couch one evening, and I noticed my, it was getting darker and darker around. And I was like, okay, that's weird. Maybe I'm falling asleep, which I thought I was falling asleep. But then at the same time, I was on the first medication I had for MS, which is interferon beta. And so anyways, long story short, I lost my vision and I lost my hearing all at the same time. It was freaking horrible. I was trapped until it came back. So when it came back, I was able to set an appointment with my doctors, and I called and I got an appointment with the ophthalmologist. And both of my optic nerves were inflamed, seriously inflamed. And so this was around the time where we were trying to figure out if we should go to another medication or not. So story time over. Let's continue with the article. Okay, so these signs can include double vision, blurriness or dimness, pain, loss of color vision, shaking of the eyes. My eyes do this sometimes. So it's not always, it's mostly the right eye, but my eyes be shaking. And that's just something I just have to deal with. These vision problems are usually temporary and likely result from nerve inflammation or eye muscle fatigue. Although some people with MS experience permanent vision problems, most can be effectively treated with steroids. Yeah, they probably put me on steroids. It's been so long. 2018 was just not a cool year for me, yo. So 2027, really from stroke to 2019, it was for me. So, although some people with choose steroids and other short-term treatments such as special lenses. Thank goodness I wouldn't have to I don't want to put nothing on my eye. Though rare, some people with MS may experience hearing loss or deafness caused by damage to the brainstem. These types of hearing problems usually resolve when the MS flare improves, but they can be permanent in some cases. Okay, now we're going to move on to speaking, swallowing, and breathing. And when I said whole health, we're talking about whole health, y'all. The whole body is affected. I've said throughout my videos, throughout the years, that the brain is the engine, which it is. Nothing else is going to work without the brain, period. So we can force it to work, when someone is quote unquote brain dead and they need to be put on life support. That's, but if we were to take the person off life support, that body would no longer work on its own. So therefore, boo. Okay, so according to the National MS Society, 25 to 45% of people with MS experience speech problems at some point. These can include slurring words or difficulty articulating, disrupted speech pattern, trouble with volume control. So if you meet someone with MS and it sounds like they're whispering, they think they're talking regular or loud. Or if they're talking really loud, give them grace. They don't know. They think they're talking normal or they're whispering. So, yeah, that's just part of it. Stuttering, changes in pitch, nasal voice, hoarseness, or breathiness. These effects can occur during relapses or times of fatigue. Treatment may include speech therapy, which I'm in speech therapy. And this is what my speech therapist and I plan to do. She was like, I need you to speak in the evening because I avoid discussing anything late at night to avoid speech problems, to avoid it triggering anything else that, like, bruh. So, people with MS can develop breathing difficulties brought on by demyelination that can impact nerves that control muscles in the chest. Difficulty controlling these muscles can begin early in the disease and worsen as it progresses. Difficulty breathing is a dangerous yet uncommon complication of MS. It often can be improved through work with a respiratory therapist. So this is what I'm talking about. Whenever you notice something, talk to your doctor, get a referral, and see a therapist anyways. What harm can it do? Seeing a therapist is not taking medicine. It's actually learning how to work your body. Okay? So swallowing problems can also develop. That's something I have a problem with. So if you're around me and I start coughing out of nowhere, my throat is closing up. So it's weird, y'all. If demyelination weakens the muscles involved in swallowing or hinders the body's ability to control them, it can cause swallowing problems. When proper swallowing is disrupted, food or drink can be inhaled into the lungs, increasing the risk of infections like pneumonia. Coughing and choking when eating and drinking may occur if you have swallowing problems and should be evaluated immediately. Speech or language therapists can often help with trouble swallowing, which they can help. Trust and believe. Okay? I keep bumping the camera. It's a long article. Good gracious. I'm already tired. Ugh. When I looked at it on my phone, it didn't look so long. Looking at this. Okay. All right. I can do this. All right. Okay. Muscle weakness and balance issues. Demyelination in areas of the brain and spinal cord that control sensation, movement, or balance results in weakness or balance impairment of the limbs or trunk. This may occur when the brain has trouble sending signals to the nerves and muscles. Symptoms can include, pain, tingling, numbness, trouble with hand-eye coordination, muscle weakness, balance issues, walking difficulties. These effects may start gradually and worsen as demyelination progresses. Many people with MS first feel pins and needles and have difficulty with coordination or fine motor skills. Over time, limb control and ease of walking may be disrupted. In these cases, canes, wheelchairs, and other assistive technologies can aid in muscle control and strength. And so I love my new foldable cane. There will be times where I am just fine walking with no cane. Maybe I can like jog or something like that. I have to know the area that is very flat. I have to know the area very well for me to be jogging. Because I have tripped and fall trying, to do all that. But, which when you're older, you fall, shit hurts really bad. But anyways, I happened to be in Walmart one day and I was looking at some of the assistive devices that they have. And I was actually looking for some Dr. Scholl's or something like that. The dancer pads. There we go. I was looking for dancer pads. And I saw this thing fold out. I was like, what is that? I was like, is that a folded cane? It is a folded cane. As soon as you open up, it clicks open. It's amazing. So it's like, it goes into my purse just fine. It goes into my backpack just fine. So when I have moments where, oops, I need assistance, I got it. And as soon as I pull it out, it opens up. I do a little video on that, like some other time. So the skeletal system. People with MS are at higher risk of developing low bone density, osteoporosis, due to common MS treatments, steroids, and inactivity. Always got to move our body. Even if you're sitting down. You can do this. That's an exercise. And the longer you do it, the more tired you get, okay? If you can't do that, you can find something else to do. Open and close your eyes. That's an exercise. Literally, it's an exercise. Okay. Here we go. Weakened bones can make individuals with MS susceptible to fractures and breaks, which can add risk if you also have balance and coordination problems. Osteoporosis can be prevention or slowed through physical activity, diet, and supplements. The immune system. MS is thought to be an immune mediated disease. This means that the body's immune system mistakenly damages healthy nerve tissue, causing damage to the myelin sheath. Immune system activity seems to result in the inflammation responsible for many MS symptoms. Some symptoms may flare up during an MS attack and resolve when the episode ends. Some MS treatments involve medications and infusions that affect immune cells to help slow the progression of the disease. However, drugs that suppress the immune system may make people more vulnerable to infection, which is why I stopped hanging around a whole bunch of people too. Because I am on an immunosuppressive treatment called Rituxan, and that is an actual chemo treatment. Therefore, my immune system is stripped. If I don't live with you, even if like I live with you, I still can't trust you. You know, so it's best for me to be alone. Okay, right now. Here we go. So here's the fun thing. Urinary and digestive systems. Problems with bladder and bowel functions commonly occur with MS. This can include constipation, diarrhea, loss of bowel control. In some cases, diet and physical therapy or self-care strategies can reduce the impact of these problems on daily life. Kegels, folks. Kegels. Kegels. Men and women can perform those. It's just like you practice, like you stop the flow of urination, and then you hold it, and then for a certain second, and then you release. Okay, that's a Kegel. All right, that's building up your pelvic floor muscles. Everyone got pelvic floor muscles. All right. In some cases, diet and physical therapy or self blah blah blah. I just said that. This is because nerve damage affects how much urine those with MS can comfortably hold in a bladder. MS can cause difficulty holding in urine, incontinence, difficulty urination when you want to, retention, voluntary or involuntary release of small amounts of urine, spasticity, and that's where pads come into play, folks. They got male pads too, if you sometimes repeat just a little bit. This can result in complications such as spastic bladder infections, urinary tract infections, kidney infections. Ow. These problems can make urination painful and very frequent, even overnight, when there's little urine in the bladder. The use of a catheter may occasionally be necessary. Doctors can help people with MS effectively manage bladder and bowel problems and avoid complications. But if untreated or unmanaged, they can result in serious infections. So, folks, if you release any urine or bowels or anything like that, it's not an embarrassment. It's your body reacting to a problem that needs to be addressed. And more than likely, if you talk to your doctor as soon as something like that comes up and you notice it's a routine thing, speak to your doctor. That way you can go ahead and get whatever therapy you need before they put you on medicine. And if they say, I want to put you on medicine first, ask for other options. Trust me on this, please, as if you don't have to be on medication. Like supplements, awesome. But if you got to get on pharmaceuticals to control something that you can probably do on your own and see if that works first, do that first. It's your body, your choice. Okay, reproductive system, all right? MS can cause an increased risk of infertility in people assigned male and female at birth. MS doesn't increase the risk of pregnancy complications compared to people without MS. Pregnant people with MS may experience fewer relapses during the second and third trimesters of pregnancy. The National MS, whatever that is, the acronym, I remember the first ones, NMSS. Of course, I'm linking the articles so you guys can make sure I read this right, okay? Also notes that exclusive breastfeeding may protect against postpartum relapses. However, let's talk about that part real quick. So during my pregnancies, especially with my, not my first pregnancy, but my pregnancy with my son and my pregnancy with my daughter. I breastfed both of them for 2 years. So, me trying to save money and give them the best leg up in life with breast milk. And if I could do it, then why not? So I did have pretty bad postpartum depression with my son. And I was put on like a birth control patch. Found out I was allergic to that. I'm allergic to weird stuff that anyways. So with my ex-husband, we were pregnant so many times. I felt fine during pregnancy, even though I had gestational diabetes, right? But after pregnancy, it was like a worse crash than what you should have, really, for recovery. And that's when, like, mood and I'm pretty sure, some of my, not just my mood changes, but there was a part up here they were talking about. Hold on, let me scroll up. Nervous system. Personality changes. There we go. I'm pretty sure I had some personality changes during those times. And now knowing that I have MS, I'm pretty sure I was having flares. So, yeah, that part. Okay. So, sexual dysfunction, such as difficulty experiencing arousal or orgasm, can occur with MS. I've experienced that, period. Even when it's solo dolo, it's difficult. This can result from demyelination or other MS symptoms, such as fatigue, pain, or depression. MS symptoms can sometimes make sexual intimacy feel awkward, but in many cases, sexual problems can be managed successfully through medication, over-the-counter aids, or counseling. Now they have over-the-counter aids for women, so in the sexual department. I personally wouldn't take them. I would try to do the counseling thing first, and then and then take it from there before I try to do any kind of medication, over the counter or not. Yeah, you can obviously tell how I feel about medication. Okay, so now we're going to talk about the circulatory system. People with MS may have a greater risk of cardiovascular disease, according to a 2022 review of research. This can include coronary artery disease, heart attack, heart failure, arterial fibrillation. Treatment to manage MS symptoms, along with heart-healthy behaviors such as eating a balanced diet and getting regular physical activity, can reduce an individual's risk. So you see the common theme, healthy diet, which a lot of people that I know who have been diagnosed for 5 years or more, always speak on a healthy diet, as one of the key factors as to living better with MS and being in control of yourself. At least while you're awake, at least for most of the time, you know what I'm saying? Sometimes we can get out of control. That was so stupid. And regular physical activity. So, yet again, a lot of people with MS that I know are very physically active. And I believe it's the knowing that if you don't do this, if you don't take care of yourself, that wheelchair is waiting for you. It is already waiting for you. So if you're not in it yet, and it all depends on when you were diagnosed, all these factors. If you were diagnosed and you're not using a wheelchair as for mobility, there's a lot you can do to try to not have to use it. And then once you get it, you can still do your exercise and your therapy outside of the chair. That's what you want. You want to keep your body strong. Okay. Here we go. Here's some frequently asked questions. What happens to your body when you have MS? First of all, not everyone with MS has the same thing. We're not all the same. Just like every single person out here in this world is not the same. Okay? Remember that. You don't want to be grouped with someone else. You and someone else may have diabetes, but their diabetes may affect them differently than yours. Not the same. Right? When you have MS, your immune system damages the protective covering around nerves in your brain or spinal cord. This inflammation causes demyelination, which may result in nerve damage and symptoms that affect different body systems. These symptoms can include tingling and numbness, vision changes, muscle cramping and weakness, and problems with bladder and bowel function. Okay? What is the life expectancy of a person with MS? MS does not significantly alter a person's life expectancy, according to the National Institute of Neurological Disorders and Stroke. The NMSS notes that life expectancy may be 7 years less than people without MS due to complications that can potentially be prevented or managed and other health conditions. Depending on the type of MS you have and the severity of your symptoms, you may experience some disability. Okay, so I'm just going to read the takeaway. While there's no cure for multiple sclerosis, a wide variety of treatment options can manage symptoms and modify the disease by preventing its progression and overall effects on your body. MS affects everyone differently. Like I said before, each person has a unique set of symptoms and responses to treatments. Period. Your allergies are not my allergies. My allergies are not your allergies. My genes are not your genes. Your cells are not my cells. You can work with a doctor or healthcare team to customize a treatment plan that addresses your symptoms and helps prevent relapses and disease progression. Those are the two things that you are looking to do: prevention of relapses and prevention of progression. Okay, everything is preventative. I hope you guys enjoyed this article I read from healthline.com and on the topic of, let me scroll up, the effects of multiple sclerosis on your body. MS is something that definitely is a ride. It's a journey. It's like, y'all, it's a roller coaster. You know, as soon as you feel like you're coasting, and then whoo, drop, and then whoo, bring it up, and then shoot a turn, and that turn, all these kinds of things coming at you. But if you remember that your whole health is what's important, and preventative care is what will keep you stable or help you manage your symptoms. You know, it's a life-changing thing. It really is. There is help out there. So if you're someone who does not have MS, but you're dealing with neurodegenerative disease, or have had a stroke, or have had any kind of health issue, take these keynotes: prevention, and make sure you advocate for yourself. And if you don't got to take pills, find something else. Your doctors can find something else. Don't let them force you. Don't let them just push the pills just to get it done and see if it works. You know, the pills, medication should be, in my mind, for life-threatening only. You know, if it's something, if your cholesterol is so high that you have to be on medication, that's one thing. But if your cholesterol is starting to get high, you can work on that by your diet and exercise. I know, because I lowered my own cholesterol, because I don't like being on those cholesterol pills, because the symptoms from those pills alone, like, no, like, it doubles the symptoms I already have, and I'm already at fall risk. I do not need to, I don't need that in my life. But anyways, I hope everyone has a wonderful rest of their day. Please listen to yourself. If you feel like someone is not listening to you, find someone else that will. Because I'm telling you, people are out there, doctors are out there that will listen to you, okay? Because it's your body. It's your body. It is your body. You know, period. Please take care of yourself. Peace and blessings to all of you. Thank you so much for watching this far.